Hi everyone, I'm Urvi Shah, a hematologist and oncologist on the myeloma service at Memorial Sloan Kettering Cancer Center. My research interests are looking at modifiable risk factors in cancer. We have summarized a lot of the nutrition information and dietary evidence that's available before these two papers that was available for myeloma in a review article in Leukemia that was published last year. So that's looking at dietary and microbiome factors for myeloma. And that is very comprehensive, going over like all of the studies that have been done so far. What's interesting is that, the pattern of what we are seeing is very consistent with all those other studies. In general, looking at individual food groups is a little bit harder because it's also important, like what is that person replacing? So if somebody was eating really unhealthy foods and then picked something that's slightly healthy, then that's good because that's better than the really unhealthy thing. But if they were picking something that's really healthy and replacing a slightly unhealthy thing or vice versa, then you have to see what they're replacing in terms of when they're eating. And so that can sometimes be challenging in large epidemiologic studies and issues around it. But I think when as patients or individuals think about this, I think instead of only focusing on an individual food group, it's important to think about the pattern or what are we seeing in all of these studies that is consistent between them all. And the consistency I see across all of these studies is showing that higher fiber and plant foods in the diet reduced risk, whether it's MGUS, whether it's myeloma, progression, all of those things. So even survival, there's the study for survival post myeloma as well from the Harvard group as well. So I think there's a lot of data and very consistent findings in most of them. I think it's empowering and informative for patients to know that there is some preventable or modifiable risk factors that could affect this disease, and it's not all just genetics or environment and things that they cannot do anything about. I know that when patients do get a diagnosis of MGUS, they have a lot of anxiety or stress around it. So being able to shift their focus from the stress of not being able to do anything to focusing on things that are within their control to live a healthier, better life is one thing that could help patients. And here we're talking about also risk reduction for development of MGUS. So on a population level, when we think about the number of people in the country and the world who could be developing MGUS, this could be more in terms of prevention measures on a population level as well, and the reasons why it's important. I think there's a lot of hesitation from oncologists and doctors in general when they look at epidemiologic studies. Some of it is rightly so in the sense that, we're looking at large populations and there could be confounding in terms of whether the population is healthy overall, and that's why. But I think that, we do the best we can with the data we have, and we adjust for all of these things. And despite adjustment, if we are seeing significance and if we're seeing it not just in one study, but in many studies and consistently over time, then I think as doctors, it is our duty not to ignore this and say like this is all confounding, which I see a lot of oncologists talk about it in terms of that. And I think that the field is moving where people are becoming more open to all of this data. And there is a good example is the American Institute of Cancer Research. Their focus is looking at diet, physical activity, weight, and how these affect cancer risk. And there's a whole body of data and guidelines from them that patients can use, which kind of take data from all cancers possible and summarize it really well. When you do a nutrition trial, you may say to a person, you want them to eat a certain diet for a month, 100%. But people are human and they may follow it 50% or 70%. So that already reduces the effect of what we can see from that intervention. Whereas if it's a drug or a therapy, it's either 100% there or not there. And so it becomes much easier to study it and quantify it in terms of did they get the drug or not. But when we do an intervention that's like a dietary intervention, it's a little bit more of like getting that data from the patients. Did they actually eat the foods? Did they follow the intervention as well as we'd like them to? And I think that that's with technology and apps and other ways, it's improving the ways we can collect this data and also study it through biomarkers of seeing if they're being compliant. But it is a challenge compared to the traditional drug studies. And as doctors, we don't get enough nutrition training. And I think that's also why there's a lot of hesitation from doctors, because if you don't know it, you don't know it. And so you assume that it doesn't exist if you don't know it. And so often doctors have not read enough about this topic and understand how these studies are done. There are many not experts, but many oncologists who will say that we don't believe any dietary data, or we don't believe any of this research because it's all confounded, it's all not true, because the diet cannot have such a big effect, and it's probably not true. But I think that this is the kind of evidence that first builds upon what you can then build the next level. And this is, unfortunately, you can't have somebody change their diet for life without giving them enough data. And so you have to go with what's available. And this is the best way we can do the research. But I think that we do get a lot of information from this that's helpful and can help patients make decisions.